Everybody, good evening and welcome to all of you, and thank you for giving up your time on this particular evening. Now, to use a Winston Churchill phrase, we're not at the beginning of the end. We're not even really, as he said, at the end of the beginning, but we are moving forward with COVID. Over the past 2 years, there have been very, very many broadcasts, and you've listened to them and watched them patiently, and we're very grateful. Sometimes the Civil Contingency Authority have had to introduce very strict regulations, and sometimes it's been able, because of the change of circumstances, to vary those, and that has continued. Now, the variations have been because of the changing nature of the virus. COVID is one virus, but it's had so many variants, and those variants will continue. When Omicron is gone, there'll be others, and there already is another that has raised its ugly head. But what the overall aim has been of the authorities in Guernsey, of the Civil Contingency Authority and the able medical colleagues that have advised us, is to make sure that the community is safe. But human beings are social creatures, and we've got to balance the risk of illness with our ability to socialise, to see our family and our friends, and to make sure the economy can run and people can run their businesses. Now, we know how difficult it's been for everybody. And I would very sincerely like to say thank you very much indeed to everybody in the bailiwick who've done so much to mitigate the effect of this horrible virus since it first arrived in the bailiwick in March of 2020. Now, whatever the Civil Contingency Authority says, whatever the States of Guernsey says, the pandemic is not over. Only the World Health Organization can say that, and it's not prepared to say that yet. And furthermore, COVID hasn't gone away. So whatever I say today, and whatever the rules and regulations may be and how they are relaxed, COVID will be here tomorrow, it'll be here next week, it'll be here next year. But thankfully, things have changed. The dominant variant, which only came up on these shores on the 9th of December, is now waning as far as we can see. So we've come down from our peak. And despite those case numbers, nearly 5,800 or thereabouts since early December, we've shown how the authorities and the people of this bailiwick have effectively managed it, i.e. dealing with this latest virus with relatively limited instructions. Now, we've relied really on two things. Firstly, as I've already said, the very good sense and decency of the islanders of the bailiwick. And secondly, and this is most important and will continue to be important, because the battle is never won, is our high vaccination rate, including the good take-up of the booster. Now, in relation to that, let's just see, because statistics sometimes tell the story, and they do here. In the first wave, which began in March 2020, there were a total of 252 cases, and sadly, 16 people died during that first two and a half month period. Since the 9th of December, there have been nearly 5,800 cases. Sadly, too many people have died, but the number is 5. And the reason for that overwhelmingly is because of the vaccination progress and the vaccinations. So you can say what you like, you can argue what you like, and I've spent most of my professional life as a lawyer arguing that black is white, but you can't argue that anything other than having the vaccination, being sensible and acting prudently is for the benefit not only of yourself, but the community of the bailiwick. Now, the booster rollout continues. If you've not had it, you of course still can have it, and there is a trial drop-in later this week at the Harbour Terminal. The next one, I'm told, is on Thursday from 11 until 2, and you can walk in with no booking, no appointments, and it only takes a matter of a few minutes to get your booster. A few minutes whereby you're doing yourself good and you're doing your citizens of the bailiwick good. Now, as I said, thanks to the bailiwick, thanks to the islanders of the bailiwick, and thanks to the vaccine, our hospital numbers and the pressures on our health service have remained manageable. Not easy. They've had a difficult task, and haven't they been splendid? We've got Dr Davey here tonight. I'd like to say on behalf of myself and the citizens of the bailiwick, thank you to you and your staff for the magnificent way that you've managed in very difficult circumstances. So what do we do next? Because you can't just stop. And already we've begun to relax and remove some of the measures and guidance. We're no longer asking islanders to work from home wherever possible. We've already reduced the isolation period effectively to just over 5 days, because if you've got a negative lateral flow test on days 5 and 6, and you can take it early on the 6th day, as long as there's 24 hours between the two, you can go to work and go about your life, as long as you have no symptoms, of course. Now, today, I'm pleased to announce, firstly, that we're relaxing from just after midnight tonight the mandatory requirement for wearing a mask in shops, theatres, cinemas, places of worship, taxis, public buildings, etc. That ends, as I say, at midnight tonight. But common sense still pertains, and we would still recommend people to wear them where they're in an enclosed, crowded or poorly ventilated space, and reduce the spread of the virus for now. But then this is a word that I've learnt the significance of very much over the last 15 or 16 months, where I've headed the Civil Contingency Authority. It's no longer proportionate to make this a mandatory requirement. We're also ending the enhanced passive follow-up rules for people who are positive but have come out of isolation before their 10th day, having had the 2 negative lateral flow tests. We will, though, again be asking them to follow some sensible precautions. Do not go to a hospital or care setting, we're asking you. Wear a face covering in crowds and enclosed spaces, and speak to your employer before you go back to work. We're also looking ahead as to how we can further de-escalate and move to a position where we're using guidance and advice to manage COVID and relying as little as possible on emergency powers. Some of that requires some further review and discussion with our neighbouring jurisdictions, such as our border requirements, so we'll make further announcements as and when we can. But where we can reduce measures locally, we will, ultimately working towards removing the mandatory isolation of positive cases. Instead, we'll recommend those with symptoms stay at home. Again, use your common sense. Always act prudently and act conservatively. If you feel ill, don't go to work. If you need to take a test, take a test. Now, we'll be setting out the entirety of these de-escalation steps in an updated version of the Bailiwick Blueprint, which is being called The Next Steps, and that'll be published online tomorrow. As I said before, COVID hasn't gone away. We may see the further waves, and we'll certainly see new variants. But we believe with prudence and with good, sensible actions on the part of all of us, we can handle them with less need for rules and more for guidance. Now, I'll ask Dr Brink now to give us an overview of both locally and globally the situation and to talk us through the next steps in the Bailiwick Blueprint. Dr Brink.
Thank you, Deputy Fairbrush. And it is an exciting day for us as we look forward and look to the future. And we've been meeting and discussing this over the past week. So Public Health has met, but also the Scientific and Technical Advisory Cell. And what we were specifically considering was the de-escalation of measures. And I'm pleased to say that these were unanimously supported by STAC and are strongly endorsed by Public Health. So we really are enthusiastic about looking at how we can move forward. Now, central to this, of course, has been our booster program. Without our vaccination and our booster program, we would not be in the great situation we're in. And once again, islanders have really exceeded all expectations. They've come forward and they've got vaccinated to protect themselves, but also to protect their community. So we're in a good position because islanders have worked hard to get us in that position. But I think it's always important to contextualise this and consider us in the wider global context. Now, if we look at the global situation, the World Health Organization is still in a declared FAQ, that's a public health emergency of international concern, and they renewed that just earlier this month. And so the strong message is COVID is not over globally, and indeed we will still see COVID within our islands, but we're looking at how we can manage this now in a different way. The restrictions remain in many jurisdictions, and a lot of those are through mandatory legislation. We're looking at how we can move forward and manage things differently. So our current position, our current favourable position, is really due to the high vaccine uptake, but also to the incredible support that we've had from islanders during the course of the pandemic. But of course, it's an RNA virus, it will mutate, and we will see new variants. Omicron is not the last variant that we'll see of COVID-19. And indeed, something that's emerged recently is a sublineage of Omicron called BA2. And BA2 has now been designated a variant under investigation by the UK Health Security Agency. Now, of course, as you know, that we have our own sequencing capacity, and although we don't sequence every day like we did in the height of the wave, is every week we take a random selection of samples to see what we've got on the island. And the week before last, what we showed is that most of the cases were Omicron, but we still did have a small amount of Delta. Last week's sequencing showed us for the first time is that we've got the BA2 sublineage on the island. So of the 11 samples that we sequenced last week, 2 of them were of the BA2 sublineage. Now, we don't know much about BA2 yet, and it's the variant that is taking hold in Denmark. So we've seen lots of cases in Denmark. The information that we've got to date, and it is very preliminary, that it doesn't appear to be more virulent than Omicron. It doesn't appear to be more vaccine evading than Omicron, but it might be slightly more transmissible. Early data, so we don't know enough about it. But as always, we do know our current situation. So we're making decisions in a really informed way, knowing exactly what our risk profile is on island. And again, having that local capacity to do all of that is really important. So as I've said, we're going to see future cases. We're going to see outbreaks of COVID, and we are going to see future waves of infection. We need to be very realistic, open, honest and transparent with the community. This is what we're preparing for in a calm and measured way. Now, what I've got here is a Bailiwick's COVID journey. And I thought it was really relevant today to go through the whole journey from the beginning. And what you see to the left of the graph here is you see the very first wave of infection we experienced way back in March of 2020. It seems like a lifetime ago now. And you see that wave of infection was caused by the original, what we call the wild-type variant or the wild-type virus, the first SARS-CoV-2 that we saw. And during that time, we went into lockdown. We had a total of 252 cases. Our peak, that was the highest number of active cases we had, was 161. And during that time, we had 16 deaths. And that showed the impact of the virus on an unvaccinated population. We locked down, and we actually had a period that we were COVID-free, or SARS-CoV-2 free, during 2020, with a small outbreak in November 2020. And then in January, we had our second wave of infection. Our second wave of infection was caused by the Alpha variant of concern. Now, both the Alpha variant of concern and the Delta are more virulent than the original one. So actually then looking at the number of cases we had 511 cases, with the peak being over 300. But during that time, we had 1 death. So we had, with the Alpha wave of infection, at that stage, we were partially vaccinated, and we'd vaccinated some of the most vulnerable in our society. We then went into our interwave period, and then what happened after that is that we opened the borders in July last year. That border opening was designated or designed to coincide with most of our population being fully vaccinated. And as we opened our borders, we saw an increase in cases, and in fact we had our Delta wave of infection in November and December 2021. And again, it's interesting because Delta, like Alpha, was more virulent than the first version of the virus that we saw. However, during that wave, we saw over 4,000 cases, and we had 7 deaths. Now, of course, every death is too much. And we mourn and think about the family and friends of every single death. But I think it does show the impact of we were dealing with a more virulent virus, but in a fully vaccinated population. And then we had the Omicron wave of infection. Now, Omicron, we know, is more transmissible, but appears to be less virulent than the Delta and the Alpha wave. And what you saw was a peak of over 2,000 cases, of active cases, and during that time we had 5 deaths. So going from our journey from the beginning, you can see the first wave, the second wave, Delta, and then Omicron. And that's what we faced over those years. Now, we will, of course, see more infections and more waves, but I think I take a lot of comfort from the fact that we were dealing with large numbers of cases. We managed them very effectively with our testing programs, and most people, fortunately, were not admitted to hospital or had serious consequences. Now, of course, whenever we're designing our measures, we looked at our case attribution, and this also just shows our journey in recent times. And what you're seeing now is a really steep decline in the number of active cases we've got. So we really are coming off that Omicron wave now. And you can see in green, the contacts, the cases in blue, the community surveillance in orange, and of course the travel-associated cases in black. All of those are coming down in numbers. And of course, that is encouraging. We could well see an uptick in cases now that we know that we've got BA2 on Ireland. But again, we'll look and manage those as appropriate. So we feel it is the right time to de-escalate COVID restrictions. And as I say, that's supported by public health and also supported by our STAC, and has been unanimously supported. So that is encouraging. And the first thing which we've already done is move to a 5-day isolation. So it's a test on day 5 and day 6 with a release on 2 negative results. So in essence, if you have a negative test on day 5 and a negative test on day 6, you can be released on the morning of day 6, so do 5 full days of isolation. The other thing that we've done is we've removed the need for enhanced passive follow-up. So we recall with enhanced passive follow-up, there was quite a lot of restrictions. People couldn't attend shops, they couldn't attend restaurants, they could only meet in small gatherings, for example, with no more than 20 people. So all of those things. What we're moving is looking between that day 5 and day 10, just asking people to be sensible. So avoid visiting care homes, hospitals and so on, unless there's a specific reason and it's pre-decided. Obviously, then that's entirely reasonable. But also discussing with your employer as to whether you go into work or not. So it is really the individual taking responsibility for the management during that period of time. Now, as we've said time and time again, COVID has not gone away, but we don't feel that we need to have the same level of non-pharmaceutical interventions. And I think one of the things that will be very popular is the removal of mandatory mask wearing, but a change to recommended. But what I would also like to ask the population, ask Islanders, if someone wants to wear a mask, if they feel comfortable wearing a mask, let's support them. Let's support individual choice and individual responsibility. And if someone feels more comfortable wearing a mask, we shouldn't look at them in a funny way. We should say that's their choice, and we're going to support everyone to make that individual choice. Remove the work from home advisory. I think that's particularly important, and I think also some of the information I've got from employers, particularly with younger people, they feel that part of the development of a person as they're going into the workplace is so important that they're actually in the workplace rather than working remotely. So I think that will be welcomed by a lot of employers. Now, further de-escalation, there's not a hard stop on the 17th of February. That's when the emergency legislation ends. But what we're looking at is what we do between now and the 17th of February. We're working with education. We've got a really great relationship with education, public health and education, working very closely together. And we're working as a team to look at what de-escalation measures, what further de-escalation measures can be put in place in schools. Now, it'd be premature to say anything more, but it's a work stream that we're focusing on. So the border policy, we're looking at reviewing the border policy, particularly in relation to travellers from outside the CTA. The UK have made various announcements, and we want to look at the implications. So that is a second stream of work that will be actively going on. And the third thing that we're looking at in great detail is what does testing look like for the rest of this year? So we're looking at how much symptomatic testing we do, what surveillance we do, testing we do, what type of surveillance testing, how we manage outbreaks, and so on. So all of that forms part of how we move on. So those are really 3 very important work streams that we're going to be focusing on. But moving forward, it is our view that the move from legislation to a process of measures being recommended, advisory, and done through community engagement, we feel that now's the time to move forward in this way. I think the bailiwick has done exceptionally well, and Islanders have done exceptionally well in engaging with all of these community measures, and we're looking forward to seeing how we can move further. So after the 17th of February, we've got to consider a number of things that are really important. So, as I said before, COVID has not gone away, but the retention of the vaccination and boosting programme is going to be of absolute paramount importance as we move forward. So we really do need to make sure that we retain those high levels of vaccination and boosting. But we also want to consider how we manage cases and contexts. So Deputy Fairbrush alluded to that, but what we're looking at is not a mandatory period of isolation, but a more practical, people stay at home when they're unwell. For some people returning to work, there might be a requirement for testing, for example, if you work in a situation with vulnerable people. So that's something we'll be looking at as well. So I've already alluded to testing and non-pharmaceutical interventions, but again, thinking about the good lessons that we've learned from the pandemic. So stay at home if you're unwell, good ventilation, good hand hygiene. So all of those messages and all of those things that people have done so well over the last year or so, last couple of years. And of course, we're not going to take our eye off the ball with regard to what's going on around us. We will continue to look at the prevalence of infection, the analysis of variants of concern in all of the neighbouring jurisdictions. We do that twice a week already, where we formally look at the prevalence of infection in all of our neighbouring jurisdictions to analyse exactly what the risk to the bailiwick is. So I think it's exciting times. We're moving forward, and I think we need to do that with hope and optimism. So thank you very much, Deputy Fairbrush.
Thank you for that upbeat and informative comment. Now, these next steps are supported by a body called the Scientific and Technical Advisory Cell, and they met this week. Dr Brink referred to them as STAC. Now, that's important because they're health professionals, and what they're saying is they believe that we can manage COVID without emergency powers and regulations, and of course that's important to the CCA's decision making. If the professionals say they can do it that way, or we can do it that way, we take great heed of that. So I'll ask Dr Raby, our medical director, to talk about the hospital experience through this recent wave and what he expects going forward. Dr Raby.
Thank you. At the moment, the hospital's working pretty well, actually. We've got 3 patients in the bailiwick with COVID who are in hospital. One's in the Menia Memorial with a diagnosis of COVID but not being treated for it. And we have 2 in the PEH. One is a long-stay patient, again, with a diagnosis of COVID but not being treated for it. And one is a long-term intensive care patient who's still being treated for it. So at the moment, quite manageable. And we're getting on with some of the important backlog of work that we've got. So we've been doing some routine elective surgery, for example, this week, which we're really pleased to be getting stuck into. We are incredibly grateful at the level of protection we've been offered by the government and by the public of Guernsey in terms of ensuring that hospital services are protected. And we've been through a really busy time in the last few weeks. It's not been due to COVID overwhelming us. It's been due to having basically a ward full of patients who are waiting for social care placements and things, and that's hurting our ability to deliver the elective work. And we've had a really busy time with patients in intensive care. We get this in winter. Patients nothing to do with COVID, but our intensive care has been busy, and running an intensive care full and overflowing, and running a COVID intensive care puts huge pressures on our staff, and we're grateful to them for rising to that challenge. Of course, we've also had during the peak some staff off with as contacts or staff who have tested positive for COVID during that time as well. And so at the moment, we're coming out of the end of what's been a really tough few weeks. And in the last week and a half, we've been delighted to get back to more or less normal operations. I think we can say that STAC, which is the Scientific and Technical Advisory Committee, as you've heard, it's got a wide range of medical professionals, scientists, other healthcare professionals on there. And we were asked specifically about moving forward with the plan as we are. And it's rare for us all to agree, but it was unanimous that we believe that we're in a good position to move forward in the way described today and in the ways that you'll see in the bailiwick blueprint when that is published. Similarly, we take soundings from primary care, and the primary care committee were asked for their views on this very question. And again, unanimous support for the measures being taken today and the measures that are being considered as part by the government as part of the blueprint. So that's where we are at the moment. Just for the record, we've had 40 patients in the hospital with COVID since the 1st of November. Average length of stay has been about 8 days. Average age of our patients has been about 65. Of those 40 patients, 18 patients have been treated because of COVID. Others have been in with other things but tested positive while they've been in. So that's the sort of mix we've been looking at over the last few weeks. And we feel we're in a good place to move forward, as said. Thank you.
Yeah, that's very helpful indeed. When I've heard Dr. Brink and Dr. Amy speak, it just makes me feel calm because they give assurance, professionalism, they're never flustered, and they give calm and good advice to those of us that have to make the decisions. So I thank them again. But questions now from the media, please. Yes.
Hi, I'm John from BBC Guernsey. Dr. Brink, has any of the BA.2 variant been found in Guernsey?
Yes. This last week, we sequenced, and 20% of our isolates from last week were BA.2. And that's really important. But I think that's the advantage, is that the decisions we make with full information. We know what's circulating, so we understand that this might propose a risk of increased transmission. There's yet to learn more about it, but we're aware of what we got, and we will continue sequencing on a weekly basis. When we were in our wave, we used to sequence daily, but now we sequence to get an idea, and if the numbers tick up, we'll sequence more frequently. And we do whole genome sequencing, so we can be quite confident of what we're detecting.
In fact, Dr. Brink said, if you remember, that they tested 11 and 2 of those were with this new subvariant or whatever they were, whatever it's called. Next question, please.
Matt Fallon, Bailiwick Express. Can I please clarify the relevance of the 17th of February? I think what you're saying is that emergency regulations or the use of legislation will, as you intend it at the present time, fall away from the 17th of February to be replaced by recommendations and guidance. Has that captured it?
That's exactly right. The regulations which are before the states tomorrow, they were made on the 18th of February and some were made today, amendment ones. They'll be before the states tomorrow. If the states approve them, then the main ones, if I can call it that, will run out at midnight on the 16th of February. Now, that doesn't mean there might not be some more, because it'll depend what happens between now and then. But the intent at the moment, or the aspiration, which I hope we can meet, is that matters will continue by guidance thereafter. But again, it will depend in relation to travel arrangements, what happens in, for example, in the UK.
Simon Delarue from the Guernsey Press. It seems a very few short weeks ago that you were announcing additional measures and class bubbles, etc. This seems to have come around extremely quickly. Just on a personal level, did you imagine that you might so quickly be announcing this relaxation?
These are the experts. No, I didn't. When we had, I thought the figures, which are high enough, 5,792 in the last outbreak since the 9th of December, would be even higher. But we've not won that battle. There will be days. I mean, over the weekend they went up 28, which is a relatively small number. They came down again yesterday. They might go up again in the next few days, because it's not going to be, the graph's not going to go down all the time. So we've just got to be measured and controlled and balanced. Personally, I am very pleased where we are, and it's clearly going in the right direction.
When are you going to stop publishing these stats online? I know there's a understanding that that's going to happen at some point. Is that something you'd like to do very soon?
Well, you're the devil if you do, you're the devil if you don't. Because if they're not published, people will say, "Oh, what are they? What are they hiding? What are they trying to do?" It must be 15,000 cases occurred in the last day because something's happened. There's some new BA4CDEFG variant. It's a matter of balance, a matter of judgment. I would hope sooner rather than later.
Did you say by the end of this month?
I'm not going to say that, because the end of this month is only the 31st of January, and we're now the 26th of January. I would hope very soon.
Presumably the rate at which you're going to need to vaccinate and boost is also going to be falling with the number of people you've already had done, as it were. And you've got the Harbour Facility. Are you going to be vacating Beausejour anytime soon?
I think that the sporting community of Guernsey have been wonderful, because it's 12 months now, just over 12 months since that facility has been out of action for sporting facilities. So thank you very much to the sporting community. The answer is yes, the intent is to move away from Beausejour, but I wouldn't like to say by the 28th of February, the 31st of March, but as soon as is practical and as possible, because we realise it should be given back for the use that it was intended for. But it's been a magnificent facility. for the vaccination rollout. Really superb. Do you want to add anything, Dr. Amy, to that?
No, I think that says it all, really. I know primary care would want me to say that they're chomping at the bit to take over the vaccination programme again as soon as they can, and I know that Dr. Brink's fully aware of that as well.
Any other questions, Matt?
Yeah, in the release which accompanies this media briefing, Dr. Brink talks about relying on the cooperation of islanders rather than returning to any formal restrictions in the event of further cases. Now, the actual number of cases today is, much lower than the peak a few weeks ago, but comparatively high if you look at an average number of cases each day over the past 2 years. And you've explained the role that vaccination has played in that. But those words suggest that you have a very high degree of confidence that it now will not be necessary, even with further waves, to reintroduce the kind of formal restrictions there have been even a few weeks ago. Can you perhaps just give us a little bit more on that, please?
So we do have a high degree of confidence in the community. I think every time we've called, the community have answered. So I think it's really important to acknowledge that. Linked as a safeguard is we have our triggers. So if, for example, the hospital was becoming overwhelmed, our critical national infrastructure couldn't run, is we can always do a reversal trigger, our adaptive triggers, which we've used throughout the pandemic. From the beginning, we've used adaptive triggers. So we have the ability, if things start deteriorating significantly, to look at what we need to do and what response we need to put in place. Now, exactly what that response was will depend on the circumstances. But I do have confidence in the community. I think Guernsey has done exceptionally well. If you just look at things like our mortality, is every death is a tragedy, but we still have one of the lowest death rates that you will see within the pandemic. And I think that's because of how the community has worked together. So yes, I have a huge degree of confidence in the community. I've got a huge degree that they'll do the right confidence, that people will respond to any request for help that we send out. But if things do get serious, we always do have safeguards in place. We never take chances. I think you probably know that by now.
Is there a time scale when free LFTs will stop being free to pick up from the States of Guernsey? Have you got a timeline on that?
Time frame for being free, did you say?
The free LFTs, so the tests that you can pick up from the information centre, is there a time scale?
I don't think we've actually fixed that yet. But again, it's common sense. If we still want people to take, if they feel ill, we still want them to take lateral flow tests. We still want them... we're encouraging people to act responsibly. And as Dr. Brink and Dr. Amy said, people have acted overwhelmingly responsibly. There's all going to be some people that don't. And that's factored into these considerations anyway. But to impose absolute dates and times, I think it's just a tiny bit premature.
You've said that the testing capacity will be focusing on outbreaks in future. Is that specifically with other variants in mind? I ask that because I wonder if, with this precipitous decline in numbers that we've had recently, which is great news, is Omicron effectively running out of places to go in Guernsey? Are there so few susceptible people in the island that we're not going to see another outbreak of Omicron?
Okay, it's actually a great question, that it really is. So I think with any new variant that occurs, how immune evading it'll be, we don't know until that variant's occurred. But I think with regard to testing, is we're developing a testing strategy, and I've been thinking about it, but we need to refine it. But we will focus on still testing symptomatic people. We'll focus on, for example, contact tracing in high consequence situations. So if we had an outbreak in a closed environment, we'd be very interested. If it was a case, for example, in an area where you had vulnerable people, on a ward with vulnerable people, in a care and residential home. So that'll be testing round outbreaks. So you've got your symptomatic people, you're testing round outbreaks, but we'll also want to do some surveillance as well. And that surveillance might be symptomatic surveillance that we can use through various methodologies we can use to look at symptomatic surveillance. But on top of that, what we then also do is look at the other end, which is admissions to hospital. So people coming in with respiratory symptoms to the emergency department, we can then test as well. Those that are getting admitted you can do some testing. So you're looking at across the spectrum, your surveillance, your community symptomatic testing, your outbreak management, and also what testing you do going into a health and care setting. So you're looking at it across the piece, and that's the type of strategy that we're looking at, but it needs to be a simplified strategy because we want to be able to manage COVID efficiently as we move into making this part of our normal package of care that we offer people. And with the symptomatic surveillance, you can also then keep an eye out for other respiratory viruses like respiratory syncytial virus, flu and things like that.
Yeah, thank you. I have two questions about medical interventions, if I may. One is, there has been some coverage recently about new or newer interventions, treatments which are now available for people who are diagnosed with COVID and need additional intervention. So I would like to know whether they are available in Guernsey or whether they will become available in Guernsey. And secondly, is there any thinking at the present time about further rounds of vaccination or boosters, or is that in abeyance for the foreseeable future?
I'll ask Dr Amy and Dr Brink to contribute. Dr Amy.
On the first one, we've got the same access as basically as the NHS and certainly as the other Crown dependencies. So Ronapreve we've had and we've used, but Ronapreve sadly is less use against the Omicron variant. So we've got Ronapreve, but it's not helping us anymore. So that was something we had for a while. Molnupiravir is a tablet you can take if you're given it early before you're admitted to hospital. The early studies were really promising for that one, less promising as the studies were sort of drawn to a conclusion, but we have stocks and we can use it. It's recommended for people who have other high risk factors. And there's some people who we know the vaccine doesn't take well in, some people with certain cancers and things, and so we have stocks of that drug that could be used for that. Sotrovimab is available on Ireland, and it's an intravenous drug. So it's something that to give to somebody before they're admitted to hospital, we need a pathway to get them into somewhere where we can give it and get them back home again. So we're working on the medical cell on that one again this week. Paxlovid, I'm going to say these wrong. We don't have it yet. We're hoping to get stocks as it's rolled out by the NHS, but we haven't got it. So we've got a good range of options. Thank you.
Dr Brink, about injections, further vaccinations.
Yeah, so I think there will be a further boosting round, but I don't think that, and my interpretation of the situation is I'd be surprised if we do it over the next 6 months. I think it's going to be some sort of autumn boost. I think the uncertainty we have is whether it's going to be a monovalent or polyvalent, so whether it's going to be one COVID or by that time whether there's Omicron and daughter of Omicron, so we do both of those, so we don't know. Looking far into the future, I don't think it's inconceivable that we could have some sort of pan-coronavirus vaccine in the future. So I think it's a rapidly developing field. So although I don't have definitive information, I would put my money on an autumn boost with either a monovalent or a polyvalent or a bivalent vaccine. So I think that's what we're looking at.
Any other questions from the media?
Businesses obviously have suffered over the last month. As president of P&R, we've heard you've been considering financial support for the last month. Does the fact no support's been given out so far mean the consideration has ended and there'll be no support given to those businesses that have struggled?
It is being considered, but it may be that where it's channelled and if it's channelled will be subject to further discussion. But it's certainly been considered, I think, at probably nearly every P&R meeting we've had over the last month or so. Yes, Simon.
On that subject, last time out, you volunteered that you sit out of P&R meetings when that issue was discussed in terms of hospitality because of your interests, declared interests. Yeah. Are you able to confirm whether you have at any point been asked to or have chosen to recuse yourself from CCA meetings on the same grounds?
Well, I've always disclosed. I don't think I have. I mean, I've always disclosed my interests. And what we're allowed to say in relation to CCA meetings, of course, is limited, as you can understand. That doesn't mean you hide behind anything. But I think I've always been open and frank. And my overwhelming consideration as a member of CCA is the well-being of the community. The first of those, there are two bits to that. Well, there are several strands to that, but let me just mention two. The first is the health of the community, both physical and mental. That's the prime consideration. And the second is to have regard to the wider economy.
I'm sure that those watching and listening will trust you implicitly on that. I wonder if, in the absence of any minutes of these meetings, and I would like to ask, as a side question, whether minutes are taken of the CCA minutes.
Oh, yeah, minutes are taken.
Okay,
yeah.
But they're not to be published, I understand.
Well, it's the law. I mean, it's not that we want to... I mean, for example, somebody asked me at something... whether a decision, I was being interviewed, was it a unanimous decision, this is a previous meeting of the CCA, or a majority decision? And I said, I'm not allowed to answer that because the rules specifically preclude me answering that. It was then taken because journalists obviously have to fill up newspapers or broadcasts or whatever, and that I was being a little coy in relation to that. Not at all. I would have loved to have said it was either unanimous or by a majority. I wasn't allowed to. So by giving an answer saying I'm not allowed to, led to some kind of criticism. But that's life. That's journalism. You know, I don't pretend it has to be fair. I don't think it has to be fair. It often isn't. But, you know, I'm here as a politician by choice. I don't have to be here, but I'm here because I want to be here.
So, sorry, I'm hogging this a bit, but how do we then go about reassuring those islanders who might be concerned about conflicts of interest?
Well, because I'm standing here, or sitting here, I should say, saying people will always see bogeyman. When I was a little boy, there was a bogeyman when I lived in Shropshire called Lofty. He didn't exist, but in my mind he was there, and I couldn't get rid of him until I was probably about 23, I think, when I matured. But anyway, it was a serious age. You know, you mature. Sadly, some people don't mature, and they see that there are conflicts of interest where there aren't. I'm under a duty, just as every state's member is, in whatever capacity they sit, whether it's in the CCA or any other committee, to ensure that our personal interests do not conflict with our duties as states members. Any other questions?
Just one last one from me. Guernsey is reducing its restrictions. Everybody's very happy about that. Are you worried that with politicians in the UK allegedly breaking the rules, that public participation, if you were forced to bring those rules back, may be a problem for the fact that many people who watch the news may be thinking it's one rule for politicians and another rule for another? Obviously, we're not talking about Guernsey, but politicians widely.
Well, all I can say is that we all should do our best to comply with the rules. I don't know whether any rules have been breached. I know the media say that the rules have been breached by Mr Johnson and others. That's for others to decide. But I fully accept that the perception that's been given out is a far from satisfactory one, and that doesn't help. But I would say the people of the bailiwick of Guernsey, I think, are the most responsible people, overwhelmingly, that there are. They comply with the rules and regulations, they follow the guidance, and I believe they'll continue to follow the guidance. If that concludes, is there anything else? Sorry, Simon.
Undoubtedly good news that you've announced today. I do wonder if there might be a few anxious people on the island who are considered vulnerable, yes, who perhaps haven't been able to get vaccinated, who obviously on the advent of the island opening up to this extent might be concerned. Do you have any words of reassurance that you might be able to put to them?
Both the lady and the gentleman to my left and to my right, and many others, including all my political colleagues and all the everybody that's spoken to me over the last 15 or 16 months that I've been involved with the CCA, our overwhelming consideration is for everybody, including the vulnerable people, because there are people who are worried. They may be physically vulnerable, they may be mentally vulnerable, you know, there's different types of vulnerability. We'll continue to give them comfort, and we'll continue to do our best, and I'm sure that Dr Brink and Dr Amy would do whatever they can to encourage them to say there's no need for them to be concerned, but we appreciate that they are concerned. Is there anything you want to add, Dr Raby, to that?
No, I think we've learned a lot during the pandemic, haven't we, about how to protect ourselves as individuals, things we can do to minimise our chances of picking things up. We know that there's improved treatments available and on the way, so there's hope for people who perhaps the vaccine isn't suitable for, so there's other things we're able to offer. We know that the virulence of the virus itself has diminished with the Omicron wave, and so I think there's a lot of reasons why those people should take comfort from those things. But I accept that it's natural to worry, and these, you know, the same people will be worried about catching normal influenza and other respiratory diseases. So absolutely a lot of sympathy with them. Let's work together as an island, as we have done, to keep these people safe as well.
Yeah, and we're not dismissive of those people's concerns at all. You know, they're valid and we understand them. Anybody else, any other questions? Well, thank you very much, everybody. Thank you very much for listening and watching. Onwards and upwards. We're moving towards a situation whereby, as we said at the beginning of this broadcast, it's common sense, listening to guidance without rules and regulations, and long may that continue. Thank you very much, everybody.